So today we will be talking about the cyst of the jaws and neck. So first are the odontogenic cysts. So the periapical or radicular cysts are by far the most common cysts of the jaws. These inflammatory cysts derive their epithelial lining from the proliferation of small odontogenic epithelial residues or the rest of malaces within the periodontal ligament. So next is the lateral periodontal cyst, a non-keratinized developmental cyst occurring adjacent or lateral to the root of the tooth. Gingival cysts of the adult are histogenically and pathologically similar. So gingival cysts of the newborn, they are also known as dental lamina cysts of the newborn or Bonn's nodules. These cysts typically appear as multiple nodules along the alveolar ridge in the neonates. So the dentigerous cyst or follicular cyst are the second most common type of odontogenic cyst and the most common developmental cyst of the jaws. By definition, a dentigerous cyst is attached to the tooth at the cemento-enamel junction and it encloses the crown of the unerupted tooth. So eruption cyst results from a fluid accumulation within the follicular space of an erupting tooth. Glandular odontogenic cyst, the rare odontogenic cyst or shallow-lodentic genic cyst, was first described in 1987, has some histologic features that suggest a mucus-producing salivary gland tumor. So odontogenic keratocyst or keratocystic odontogenic tumor, they may exhibit aggressive clinical behavior, a significant recurrence rate, and an association with nevoid basal cell and carcinoma syndrome. They are found anywhere in the jaws and can radiographically mimic other type of cysts. So calcifying odontogenic cysts, there are developmental odontogenic lesions that are occasionally exhibiting recurrence. So the non-odontogenic cysts are the globulomaxillary cyst or lesion. They were once considered fissural cysts which are located between the globular and maxillary processes. So nasolabial cysts, they are the soft tissue cysts of the upper lip. It has been suggested that these lesion represents the cystic change in solid chord remnants of the cells that form the nasolacrimal duct. Median mandibular cysts, they are similar to global maxillary cysts which were once considered fissural cysts. So nasopalatine canal cysts, they are also known as incisive canal cysts within the palatal soft tissues at the opening of the canal. So the pseudocysts, aneurysmal bone cysts, they appear radiographically cyst-like lesions but microscopically exhibit no epithelial lining box. This represents a benign lesion of bone that may arise in the mandible, maxilla, or other bones. The traumatic simple bone cyst is an empty intrabony cavity that lacks an epithelial lining. The designation of pseudocyst relates to the cystic radiographic appearance and gross surgical presentation of these lesion. The static bone cyst or stiffness bone defect is an anatomic indentation of posterior lingual mandible that appears to resemble a cyst on radiograph examination. So the facial osteoporotic bone marrow defect are uncommon lesions that typically present as asymptomatic focal radiolucencies in areas where hematopoiesis is normally seen. So that would be all. Thank you.